So 3, 2, 1.
Hello, I'm Laura. I came from the University of the Basque Country.
I'm Manu. I come from Spain, from the University of Uranate. And
We're gonna present you our project. So, start, please. First of all, well, this is the index, and we are going to follow the points Mitchell presented us. And well, first of all, it's important to know that before starting any process of training with our client, we have to take into account the medical limitations of our client and check with the doctor or its health care provided if she has any problem to focus on, and then we should focus in her behavioral features in order to be most efficient possible. Like we should take into account her preferences and which type of exercise she prefers and which one no. And one way to do it is using questionnaires in order to know better the information and all the important data of our client. We are going to follow an individualized program, taking into account again our patient preferences, and we are going to do at the very beginning a training test to know in which point is our patient, in which point of physical activity is our patient, and we are going to follow like series of exercises with its respective correct technique. We are going to evaluate her physical form, and we are going to do a tracking of her progress in order to know which was the starting point and which will be the final point.
So first of all, we have to know the information about our patient, our client. We know that she's a woman. She is 25 years old, and she has a problem with weight gaining. So she's not completely sedentary. She likes to walking, jogging, and things like that. We ask her her aims, and she wants to shift to the normal weight category, revitalization of the body, and strengthening. So knowing these details, we are focusing the workout in hypertrophy plus strength. So let's go for the workout training. We have to do a detailed program for 1 or 2 months. So we are in the first week. We have to know how the client has his techniques about the principal exercises. So we are focusing in the 1 and the second week learn the basic techniques for her, doing the basic exercise, and we are doing that by full body session. So we are in one session we are doing the full body exercises like squats, deadlift, and more. We are going to see in the next slide. So after that, after the first and the second week, we are going to do 4 workouts per week. We can do more, but in the beginning we can give her too much workouts per week. So when we finish the beginning, the 4 workouts will be divided in 2 zones about upper body 2 and upper body lower body sessions, focusing in exercise of pull and push. We have to remember that the key elements for this are the nocturne and nutrition that we can't teach her because we don't know about it, and we have to let her go to a nutritional doctor. So first week we are going to do 3 days with 1 of rest between them, focusing in the technique. In all our workouts, we are going to do some warm up with aerobic activity plus joint mobility, around 10-12 minutes. And after that, we are going to start with a squat. We have to focus on the technique after bench press, lat pull down, lunges, barbell shoulder press, and seated leg tucks. It doesn't matter the weight she can do or she can stand, because we are focusing only on the technique and trying her to introduce to the workout. So it's focusing on the technique only.
It has to be easy
Easy
at the beginning.
at the beginning. In the second week, we are going to change a little the exercises, because we have to know how she can think about other exercises. So we are going to do deadlift, tricep disc on parallel bars, standing rowing, leg press, upright barbell row, and the clean reverse crunch. After this week, we want to see like her progress and her techniques, asking her how she feels about this training. And finishing the second week, we are going to start with the real workout. Sorry. And this workout will be during like 5 weeks, 3 weeks until 8 weeks, and we will work with 2 days training muscular strength and 2 days training muscular endurance or hypertrophy, as you can name, in order to change the body composition. So the first day is gonna be upper body, so we are focusing on bench press, standing rowing, seated cable row, seated shoulder press, tricep pull down, the clean reverse, and up crunch machine. So we are going to work the strength, so low sets and low repeats, 3 sets per exercise and 4-5 reps, depending on how she feels. The second day, we are going to focus on leg and strength, leg strength. So we are going to do a squat with barbell, leg curls on machine, deadlift, standing count raise, leg press, big knee hip raise, and crunch. 3 sets for 5 repetitions in order to focus on the strength. Week by week, we are going to try to increase the weight of the exercise in order to have an evolution. The third day, after 1 of rest, because it's very important to rest, we are going to do upper body again, but with other exercises in order to get a better body composition. So we are going to do bench press declined, lateral raise, alternating dumbbell lift, bicep curl on squat bench, crunch, and knee ups. More sets and more reps, because we are focusing on hypertrophy, not strength. So 4-5 sets of 8 or 12 reps. And the last day, we are going back to leg day. It's very important. And hypertrophy, leg hypertrophy day. So we are going to do squats, standing leg curl, deadlift, seated calf raises, oblique crunches on the floor, and knee ups again. So, as we said, working on hypertrophy for 5 sets of 8 to 12 repetitions.
And finally, after these first months on warming up, we can call it like that, we expect to increase not only our customer strength, but also her muscular mass and her body weight. And now, as Manu has said, after this period of training and like more technique period, now we are going to focus on growing the muscle and to develop this hypertrophy. And now the trainings are gonna change. We are gonna focus on the principal muscle groups, and we are gonna train, like for example, for training the legs, we're gonna focus on exercises who involves more than one muscle. For example, squats, With this exercise, you can work out quadriceps, the gluteus, hamstrings. For example, if you want to work out the back part of the leg, you can use the deadlift. That is a very complete exercise for hamstrings and also for gastrocnemius. And the methodology we're gonna follow will be like, first of all, before any training, we're gonna set the RPM of our client to know in which point of that exercise is our client. And once we know this RPM, how many kilograms, how is she able to lift, we will measure the progress once we know that. And here you have some examples. This is one example of training. As I said before, you have squats, you have press bench for the upper part of the body, then you have deadlift and standing rowing. And this is a training for one day. For example, you start the training and you're gonna do the squats, the press bench, the rowing, and the deadlift. And this is like the methodology. We're gonna start with a measurement of the RPM that we have imagined that it's like around 30 kilograms, because we have said that it's not a totally sedentary person. And we're gonna start like doing 3 sets with 3 repetitions at the 75% of his her capacity, sorry. And we are gonna follow this methodology after the days passes. And once we know that this person is able to, for example, adding 1 set or doing with more weight or adding another repetition, we will write it and we will track this process. The most important part that we have to take into account is to write everything that our client is reaching, everything she is achieving, in order to take that final objective that it's like getting to that normal weight category. And if we follow these exercises with its corresponding rest in between series, because it's very important to rest, as Manu have said, we think it's the best option to reach that final aim. And that's all. Thank you for your attention.
Thank you.